Hi, I'm Dr. Carey. I'm a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce two guests who have joined me to share their child's experience with common cold. Today, it's common cold. This is Anne, the mother of Gavin, with a busy little 2-year-old, and Sarah, the mother of Hannah, who is 4 months old. Welcome.
Thank you.
First, let's set the stage for what a common cold is. The definition that I tend to give is 3 to 4 days of clear runny nose, followed by 3 to 4 days of greenish yellow runny nose, followed by 3 to 4 days of clear runny nose, and then hopefully it's gone away by then. There might be a low-grade fever somewhere between there, somewhere between 100 to 102 that will last for 2 to 4 days, and the coughing tends to be worse at nighttime and early morning with a little bit more coughing towards the end of the cold, because when that congestion finally breaks up, there's more postnasal drip, there's more throat irritation, there's more coughing. But common colds can be really frustrating in little children because they can't blow their nose very well, so they get really frustrated in trying to clear it. Why don't we start with how Gavin, who was 2, how Gavin handled the cold. What exactly happened during the time?
He just seemed a little cranky, and then I just noticed I'd look over and it was every few minutes he would just have runny nose coming down, and it would be clear for the first few days and I didn't really pay much mind to it. And then, like you said, it was after a few days where it was a different color. And
how many days did that last?
I would say probably this recent cold, it seems to have lasted probably about four days now, with the green and then the discolor.
Was there any fever with it?
No, not that I noticed, But he seemed a little more fatigued. And
okay. And how about for your child?
For Hannah, it was scary because she was so young, and my oldest, she didn't get a cold until she was almost a year, but Hannah was just a couple weeks old. So it was,
So we were less than a month old when Hannah was ill.
Yeah.
Okay.
So I was really, really nervous, but it was just the general, she was really congested and really coughy, and because she was so congested, she had a hard time eating and sleeping. She was just really uncomfortable. She never had a fever, thank goodness.
And did you breastfeed or bottle feed Hannah?
At that time, she was exclusively breastfed.
Breastfed. And describe what was happening when you say she was frustrated eating. What would she do when she would try to latch on?
Well, she would latch on for just a couple of seconds, and then she couldn't breathe through her nose, so she would have to unlatch and gasp for air, and she would start turning purple and get really frustrated because she was really hungry, and it was just a vicious cycle.
I remember seeing a little baby who was a little bit older than Hannah at the time, probably about 3-4 months, in the emergency room once, who was really dehydrated and really couldn't eat and was as congested as can be. And I just remember the picture of the little one with a bottle right up to the mouth and would get really, really frustrated and try to suck it but couldn't because the little one could not breathe through his nose, and he just threw that bottle across the room in frustration, which really points to little children are primarily nose breathers, and if they can't breathe through their nose well, they don't eat well, they don't sleep well, and then you're not going to sleep well. Yeah. So really it comes down to clearing that nose. So what did you do for her to clear that nose?
Well, I came to see you. Just because I was so nervous. She was so young. But you showed me, how to use the nose aspirator properly with the saline spray. And oh man, that was like a lifesaver.
That really is key.
Oh.
And at some point we will go through the process of suctioning a nose on another video and show how to really clear a nostril really well with a suction bulb, which is really all a parent needs. Most of the time they don't get it right because they don't plug the other nostril when doing that, so you don't get really good suction. But again, I'd like to hand a child a Kleenex and say blow. It's just not going to happen. It becomes a little more challenging with a 2-year-old, so what did we do with Gavin?
He actually is pretty good at blowing his nose. You have to hold it for him, but I'll just say blow and he thinks it's funny. So he did pretty well with that.
Perfect.
But when he was a baby, it was awful. That suction, he was just deathly afraid of it, and we would have to hold him down, and it was just torture for him.
It hurts us worse than that.
Yeah, I know, it's hard. They squirm, and it was almost impossible to get him to do that with the suction bowl, but
it can be a two-person. It can be
yeah,
a two-person
definitely
job.
a two-person job.
Absolutely.
Yeah.
Definitely. And what were your biggest concerns with the cold? What made you most worried for your child? Why don't we start with you?
I was just afraid with her being just a few weeks old that it was going to turn into something worse, or that, you know, her body, it's, you know, not immune to everything out there, so it can just develop really, really fast, and I was just really scared for her.
For children who are that young, for under a couple of months old, it certainly can be scary. The fever would be my biggest concern initially, and in any child under 2 months of age, they really need to see the pediatrician right away for fever, because babies don't have many ways of telling you how they're feeling. They either don't eat well, they don't sleep well, they run a fever. I mean, there's not too much that they're not going to say, Mom, my tummy hurts. So you have to try to figure it out, and when you have a sign like a fever, that certainly is a reason. What was your biggest concern?
Just that it would build into something bigger and we wouldn't realize that he had an infection, or he's never had an ear infection or anything before, but I don't know exactly what those signs would be, so just that it would be an infection that we wouldn't know about.
And that comes down to a lot of the things that we're concerned about with the cold isn't the cold itself, but secondary infections that can happen after a cold.
Right.
And the ones that we think of most often are ear infections, pneumonia, and sinus infections, although the sinuses in babies are pretty small, so they tend not to get sinus infections as much as older people do. And this happens because when the nose gets stuffy, we get fluid built up in the middle ear, and that fluid sits there for a few days. And imagine a cup of chicken broth on a kitchen counter for a few days. At first it's going to look good, but by 3 to 4 days something is going to start growing in this. And that's exactly what happens in the middle ear. So it's a really pretty picture, but you get a whole bunch of things. And the same with the pneumonia. Fluid settles in the lungs, it sits there for a while, and then something grows. So it's pretty common for parents to come in right at the beginning of a cold, when you're right at the first 2 or 3 days, and you take a look and say, oh, common cold, no, everything is wonderful, just suction out the nose and everything will be fine, and wash your hands well and be on your merry way. And then 5 days later you're back saying, what's going on here? My child's had symptoms that are going on for so long, and things that concern me are green runny nose that goes on for more than 3 or 4 days. It's, you know, what's going on here? Why is it green? We get a low-grade fever, and again, any fever in a child under 2 months of age should be seen immediately. But in a 2-year-old, low-grade fever for 2 to 4 days, it goes away, and then suddenly the fever comes back, and you're saying, why are we getting a fever spike when this cold should be on its way out? Persistent day and night coughing, continual cough, not just night and early morning from an irritated throat, but constant coughing, that makes me concerned that there's a pneumonia. So these are the things that make me think, this is a little bit more than a cold. And these tend to develop 4 or 5, maybe even 6, 7 days into a cold. They're not the kinds of things that happen on day 1 or 2 in most instances. Once in a while I'll be caught off guard with a child who has 2 days of symptoms and an ear infection, but that's the exception rather than the rule. What else concerns you besides secondary infections?
Probably just exposure, because we would be around other kids and I wouldn't want to get the other kids sick. So at this point he actually has a cold right now, and we're at the end of it and it's clear now.
Right.
But yeah, I guess I would just be afraid that he would get other kids sick, but I don't really incubate him either. So with the common cold, and it's just very subtle symptoms, no fever or anything.
And you have an older child,
Yes.
too, and that comes down to Dr. Carey's rule number 350, which is the first child is always healthy, the second one is always sick because of the first child. That's the one who's touching everything, that's the one who's going to bring it home, and that's why hand washing is really so important to try to reduce these recurrent colds. Decongestants don't tend to work very well in children. They're not even recommended anymore, so it's frustrating. We don't have any other methods for dealing with this. If they're uncomfortable, some Tylenol, or if they're over 6 months of age, some ibuprofen. So either acetaminophen or ibuprofen would be good for helping with the fever, making them more comfortable. Really all we're trying to do is comfort care. Try to get them to take as much fluid as possible. That would be really nice. I don't worry too much about their appetite. If they feel like eating, they'll eat. If they don't feel like eating, they won't eat. It's the fluids that I care about. about the most. And those are the primary things that I worry about. Humidifiers help sometimes. Humidifiers can soothe the throat, make them worthwhile. Have you ever taken vitamin C for yourself when you're sick?
Yes.
And you?
Mm-hmm. Yes.
Yes, and Linus Pauling did, and many famous people have, and there's no evidence to show that it does absolutely anything, although I probably have taken it myself at some point or another. The other thing that happens a lot is we go through clear on your nose, and then we go greenish yellow, back to clear, and then a few days later we're back to greenish yellow again. How many colds do you think a child gets per year on average?
You know, knowing my little hand, it'll probably be a lot.
Want to guess on a number?
8 to 10?
It's a pretty good guess. About 7 to 10 is about right.
Yeah.
That number can double in daycare setting. Mm-hmm. So if you do the numbers, you can have a child who's sick 100 days out of the year, and that's just a lot, especially for the first couple of years of life. So I tend not to limit milk during a cold. Some people do because it can help a little bit more. It can help produce. It will lead to the production of more mucus, I should say. I don't really like to because they need the calories, they need the nutrition, and a little bit of extra congestion isn't really going to make a big difference on the grand scheme of things. So I would rather them get the nutrition than not, especially for the young ones who sometimes that's all they want to take. Mm-hmm. And I also avoid combination medicines, especially as they get older, for the children 4 and older that can take medications. I really don't feel it's safe to give decongestant combined with fever-reducing medicine and other things, because oftentimes we give way too much one medicine over the other, and that's really not good. So those are sort of the basics of the common cold, and the last point to come with is that this is a virus. Antibiotics aren't going to work with it, and that's why doctors tend not to prescribe it unless they get a secondary infection, such as a pneumonia or an ear infection. I thank my guests for sharing their experience with us. I'm Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to www.drcareys.com, where at Dr. Carey's we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ear.